Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Today I wanted to give you what I call my words of wisdom, if that makes sense. These are just tidbits that I've written down that I've come across in the last few days that for some reason, if I was taught this in school, I don't think I remembered, but it's something that I encounter on a daily basis. For example, on this channel, I try to teach you guys as coders, we code what our physician says is wrong with our patient. Yes, that's true and that's dandy. And no, we're not physicians, so we're not expected to pick up these diagnoses, but we're expected to have a knowledge, a working knowledge of these diagnoses, if that makes sense. So for example, if I come across for a diagnosis of an abscess, now, right off, the first thing comes to mind to me now that didn't click before is that when there's an abscess, a lot of times there's some type of procedure called an incision and drainage. And that's where they stick a needle into the abscess, because remember, an abscess is like a bubble of pus. And so what they'll do is they'll stick a needle into that bubble and withdraw the fluid out. And not only does that make the abscess go down, but they can analyze that fluid to determine what type of bacteria is involved so that they can treat that patient for, if it's staph or strep, they can treat you with the correct antibiotic to help fight off that infection that might be still in the system. So one thing that I'm seeing a lot of at the facility that I'm at now are what they call perennial abscesses. And these are abscesses on the butt, on the hip, whether it's right on the crack or on the butt, on each one of the hips. And this type of abscess tends to reoccur. It comes back and it'll come back. And they're painful, they're hard to sit on, and they actually will build up and become a big bubble, a big painful bubble. And so when it gets to the point that you have to go into the emergency room or you have to go in and see your physician about it, then we know it's going to require some help. And in a case like this, it's usually an incision and drainage is the procedure. So as a coder, I know now, and if I was taught this in school, guys, it didn't click until now with the experience of coding them. I know to look for them. You know, you're taught in school what a diagnosis is, what a procedure is, but I wasn't taught, or it didn't sink into me that I need to look for that. So I've missed incision and drainages before. I know to code it if I see it, but if I didn't know to look for it, a lot of times I didn't code it. So now with certain diagnoses, it's clicking now. I'm realizing, oh, they've got an abscess. An abscess usually, not always, but it usually requires an incision and drainage as the procedure to correct. Okay? So now if you ever see abscesses in charts that you code, look to see whether it was just treated with medication, which is usually an antibiotic, because remember, it's a bubble with pus in it. And so sometimes if it's not bad enough, they'll just treat it with penicillin or some type of antibiotic. But if it's severe enough, they will do an incision and drainage to pull that fluid out to give some relief. So that's an example of a procedure that can be easily overlooked. Another one is when there's an injury. Patients tend to step on nails or get cut with a knife or a piece of metal or something that breaks the skin. If there's any type of injury, they tend to vaccinate, do a tid-bits on that patient to prevent any type of metal products from getting into the body, causing some type of poisoning. So when that immunization, that type of vaccine is given, then I, as a coder, I need to code the Z23 that states on the diagnosis side that an immunization was given. It's kind of like chemotherapy with cancer. You're taught to identify the cancer, and then when they come in to have chemotherapy or radiation, then use a diagnosis for chemotherapy or radiation, and then when that procedure, chemotherapy or radiation, is administered, to also assign the procedure code for radiation or chemotherapy. So now it's beginning to make sense and click. And you've probably been taught it in school, but until you actually use it on a daily basis or get experience using these things, it just didn't click. At least it didn't click for me. And on my channel, you guys know I try to teach you things that may have been straightforward for somebody else, but just didn't quite click for you or for me. I want to give you these little tidbits or little wisdom tips. Another one are splints. When a person comes into the emergency room and they've got a fractured arm or leg or dislocated, and the physician ends up putting a splint on the arm or the leg, there are splint codes in your CPT book that we need to assign. 29125. It's in that area of your CPT, whether it's arms or the legs. Long or short arm cast or splint. Long or short leg, from the thigh to the foot or just from the knee down. We need to identify those splints. Also, the external cause injury codes, and I probably have said this in one of my previous videos. If an injury occurs, then we need to also identify what I call the who, what, when, where, and how of the injury. So that's where your external cause injuries, which are in the index behind your alphabetic index, that describe patient fell from bed, in a nursing home, while playing whatever, and then what type of patient were they, civilian or military. So your external cause codes identify the extenuating circumstances behind the injury, whether it was a car accident, whether it was some type of fall or a trip or a slip. So that's the type of injury. But what activity were they doing? They were dancing and they tripped. They were in a marathon running and they tripped. They were riding their bike and they flipped over the bike. Where did it occur? In the mountains, on a street, a highway, on a sidewalk? Was this a student-involved activity? Were they playing soccer or basketball with the team? And they tripped and fell and bent their finger all the way back and it's dislocated. So there you identify they were playing basketball on the basketball court at school and they are a student. Y99.8. Okay, but you have to identify all of those extenuating circumstance codes. And then the fifth thing I want to share with you is spinal taps. I always missed spinal taps. And I have to think about conditions that justify a spinal tap. Patients come in and their fever is so high. The physician can't figure out what's going on. A lot of times, especially in children, they will do a spinal tap, which is where they remove fluid from the spine to analyze it to see what's going on. And so when they do these spinal taps, I have to know to look for it so that I can code it. So again, these 5 tips, what I call my 5 words of wisdom: abscess, injury, splints, E-codes, and spinal tap, are examples of things that as a coder, I've learned I have to look for to know to code. I know as a coder I'm taught to code diagnoses and procedures, yes, but I'm having to delve in even more so to understand exactly what procedures go with what diagnoses. That way I can code them. So I'm hoping these little words of wisdoms that I'm going to try to pick out of what I experience in a day as I'm coding charts, I want to share with you so that you don't wait 20 years and realize, you know what, that's what I'm doing. And I may have been taught it in school, but it just didn't stick with me when I was in school, but it's making sense now as I'm coming across these abscesses. Yes, incision and drainages are done, but I need to know to find them because everything is not always just laid out. This is your diagnosis and this is your procedure. No, I have to learn to read the chart and find it. And so as I'm coming across diagnoses, I read to find out what all happened, but I've also studied what exactly is going on with this disease process to know if this is the diagnosis, what typically cures it. So now as I'm reading the chart, I immediately look to see what's going on with my patient. Okay, right then I know they tend to give antibiotics. They tend to give pain. Oops, they're having dental pain. They'll give antibiotics or they'll give pain relievers for that. But in severe cases where the patient is complaining, they tend to give them an injection. And I know now to capture those injection codes. Coding is just so vast, guys. I just want to share little tidbits of wisdom with you. And again, it depends on the facility where you're at. But just keep these tidbits and little bits of wisdom that I'm sharing with you in mind, because for some reason it didn't sink into me when I was in school. But I'm learning it and I'm seeing it now in day-to-day coding. All right, guys, that's it. I'll be back soon. Thanks.